to make the necessary lifestyle changes that are required. And today we have with us a panel of endocrinologists who will help you understand and manage pre-diabetes better. Joining us on the broadcast, Dr. Mohan T. Shenoy, who is a consultant endocrinologist, Shri Gokulam Medical College, GG Hospital, Trivandrum. We also have Dr. M.R. Varun Kumar, consultant adult and pediatric endocrinologist, VMC Specialty Hospital, Velamal Medical College, Madurai. And we have Dr. Anish Behel, consultant endocrinologist, Apollo BGS Hospital, Wellness Super Speciality Center, Mysuru. Thank you very much for being with us, doctors. Dr. Shenoy, to you first. What is pre-diabetes and how long can this condition last in a person? And also, when or how soon can pre-diabetes progress to type 2 diabetes?
Yeah. Thank you for that question. Thank you ESI and USP for this opportunity. So we are speaking on health and wellness, myths and facts versus hormones. So to avoid pre-diabetes turning into type 2 diabetes, we definitely have to have an awareness about what is pre-diabetes. So pre-diabetes means it is a state where there is not yet diabetes, but just before the onset of diabetes. So it's a window of opportunity to screen for the diabetes. So diabetes may be there in the family. It may be a person with an irregular lifestyle. Type 2 diabetes is the more common among the diabetes type. There may be heart disease in the family. The person may have a high blood pressure. He may be slightly overweight or sleeping at irregular times. So age may be more than 35. So these are the risk factors which are described for the pre-diabetes. And when diabetes is started, you know that it is like a time ticking. So we have to know which is the type of diabetes. For those things, we should always remember that this opportunity which has been just before the onset of diabetes, that means the glucose levels are just not yet in the diabetic range. The ADA or the American Diabetic Society describes the cutoffs for these values. So the fasting value of less than 100 is the normal value. So pre-diabetic person, the value will be 100 to 125 milligram per deciliter. And you know that there is also something called HbA1c, which is the marker of hemoglobin average in the glucose. So the excursion of glucose is measured there. So HbA1c in a normal individual is 5.7%. So in pre-diabetes is between 5.7 to 6.4. And we also do an oral glucose tolerance test to measure the load, the postprandial values. For that, even the normal value should be less than 140. For pre-diabetic individual, it will be 140 to 199. So there are many organizations which define differently, but this is the common definition by the American Diabetic Association. So it may last even as short as 3 months, or it can be prolonged. When we adopt healthy lifestyle, we can even reverse the pre-diabetes. So the borderline time is not defined. The prevalence exactly in India is ranging from 10 to 12%. So definitely lifestyle management is the cornerstone of pre-diabetes, and definitely we have to have a proper regular blood test and glycemic control.
Right, Dr. Kumar, is it possible to have pre-diabetes and be unaware of it?
Good afternoon, one and all. Yes, absolutely. As Dr. Mohan has described, the pre-diabetes is a condition which is actually a forerunner for diabetes mellitus, particularly type 2, where the blood sugar is it's above the normal range and it is not reaching up to the level of a diabetic definition. So when it is lesser than the diabetes range, the people, they don't tend to have the increased blood sugar related symptoms, like for example the increased frequency of micturition or urination. Their thirst may not be that high, they may not lose that much of weight. The people tend to look normal, but when they look at the blood test alone, the blood sugars will be on the higher side. That's why the pre-diabetes is going to be more of like a silent disease, which may be a precursor for type 2 developing in the later phase. When you look at the prevalence, it is on the higher than the prevalence of type 2 diabetes mellitus, approximately 30 to 40% in US studies. Indians, we have even much higher rates. But when you look at the type 2 that is being developed after pre-diabetes, it's much on the lesser side. So targeting the pre-diabetes early will help out for the betterment. So what are the risk factors, particularly if the patient is anyone who is like sedentary, who has a higher BMI of more than 23 for Indian standards, and if the patient is getting a recent increase in the weight, if they feel a minimum bit of tiredness also, if the family history of type 2 diabetes is there, then these are the people, and if the age is also more than 45, these are the people who need to have a blood test so that they can detect the pre-diabetes early.
Right, very interesting. Dr. Bahal, is it normal to have your blood sugar fluctuating at different levels if you have pre-diabetes?
See, good afternoon to everybody. Blood sugars do fluctuate in patients who have pre-diabetes, but it would not be to that extent that we see in patients with a full-blown diabetes. There are a lot of factors which influence these blood sugars, right from what you eat on day-to-day basis, the physical activity levels that you follow, whether you're following any exercise schedule, even the stress levels have a significant impact on the blood sugar values. In spite of all these factors, we still do not recommend home glucose monitoring for patients with pre-diabetes because it's something which is not very cost effective. What we do recommend is that once in 6 months, the patient should undergo a lab test where we ask them to do a fasting sugars, a postprandial sugars, a glycosylated hemoglobin. We also ask them to look at lipids, and we keep a check on their weight and their blood pressure because these are common comorbidities which are found in patients with pre-diabetes. A lot of them have obesity, some of them may also have dyslipidemia and blood pressure. So to give a more holistic approach to the whole issue, we just don't look at sugars, we also look at all these other factors also. Thank you.
Right. Dr. Shenoy, what are some of the most important steps that people can take to prevent pre-diabetes from progressing into type 2 diabetes?
Yeah, thank you for that question. So pre-diabetes is just like a wake-up call. So when a person is diagnosed with pre-diabetes, we should have a personal roadmap to prevent diabetes. So we know that we are on the pathway to getting better health. So hormones play an important role for that. So first, just like Dr. Anish had told, that stress is one of the major factors we should address. Sleep pattern, taking enough water, timely food, exercise daily, and keep your body BMI in check, that is the body mass index. So excessive weight should be lost in case of weight issues, and directions of better eating. So even if you eat out, try to minimize the junk food which you are eating, and we have to take travel tips also when you are moving. So when you are carrying enough of whatever of homemade food, it's always better. And always fine tune your pattern of lifestyle. So the balanced diet is, we all tell, but sometimes we have to adopt our own type of way of dieting. We should not go by the fad diets like intermittent fasting or keto diet, because both are harmful. So balanced diet is the traditional teaching from ADA, and get over the bad habits, because like smoking, it's bad for your body, lungs, just like diabetes also gets worsened by those chemicals which release. Alcohol is bad. So also try to have a balanced diet with fruits which can be made very good, delicious, cut fruits, not the juices, and get enough fibers when you are eating. So as we know, aging cannot be prevented or delayed. So when we know that we can do proper timely exercises, so maybe 30 to 40 minutes of isometric exercises. Inactive lifestyle is also bad. So when you have a lady who has diabetes diagnosed in pregnancy, it may be an opportunity called gestational diabetes. So even those individuals should screen them after maybe around 3 months after delivery, and continue to screen them after 1 year. So because they may also develop 30% chance of going into type 2 diabetes. These are the various measures we do, but of course, as we know, we don't go by the traditional teaching of trying to give everybody medicine in pre-diabetes. So pre-diabetes is managed by a healthy lifestyle, stress reduction, proper diet, exercise, and always consult a neighborhood endocrinologist for your opinion. Thank you.
Right. Also, if I can come to you, Dr. Kumar, what is the role of the glycemic index of food in the management of pre-diabetes?
Very well. Food is important. It has an important role in the development of pre-diabetes and diabetes mellitus. We are all the rice eaters of the continent. So rice is considered to be the most highly effective carbohydrate meal, which has the lowest amount of the fiber. So rice eaters, basically, we tend to have a lot of the energy that is being supplied, which we don't use it for the healthy living. So when you try to look at the food, we divide into carbohydrate, the proteins and fat. The carbohydrate is the one that gives us the increased risk of development of the pre-diabetes and diabetes mellitus. So when you try to look at the carbohydrate metabolism, so how we eat, once we eat the carbohydrate, it goes into the stomach, it gets digested and it is getting absorbed into the bloodstream. So there are indices like the glycemic index, which tells us that the time that it takes for the body to convert the carbohydrate into simple glucose in the bloodstream. So that is what the glycemic index tells us. So each and every food, it is going to have a different glycemic index. For example, rice is going to be considered as a high glycemic index food because it is going to be broken down and simplified very fast. Juice, when you drink a cup of juice, again it is going to be having a high glycemic index. So this glycemic index will tell us how to choose a particular carbohydrate in the food so that the meal planning can be done. So when you try to choose the glycemic index, it is actually a number. It is between 0 to 100. The numbers between 0 to 55 are considered as a low GI food, particularly, for example, the fruits, vegetables, the whole grains, the unsweetened milk and milk products, everything are considered to be on the low GI food. So when you say low GI, the conversion to the sugars are going to be slower. If they are slowly absorbed and assimilated, then the chances of developing the pre-diabetes is on the lower side. So the choosing the meal, right meal and the right proportion is going to give us a time for a betterment of the pre-diabetes and diabetes. So a low GI food and a high fiber diet will guide us for a better meal planning for the treatment of pre-diabetes and diabetes mellitus. So you need to choose a low GI food, particularly the fruits and vegetables, which will contain ample of fibers. The meal should contain adequate amount of nuts. They should contain ample of water. Instead of choosing the polished, the refined carbohydrates, you need to go for the whole grain cereals and pulses, so that the amount of fiber will be increased and the GI can be reduced. So this will be an ideal choice for a meal planning. Of course, we need to avoid certain foods like the processed foods. You need to avoid the juice that I described. The fresh juices and the bottled drinks should be avoided. You need to stick on to the meal planning. You should not binge eat. That is, eating and drinking into number of times should be reduced. You need to have adequate the meal planning before an exercise as well. So this meal planning will guide us regarding the prevention of pre-diabetes and diabetes.
All right, Dr. Behl, many people get confused with the many types of diets that are available, especially if people are on the internet and searching for the best kind of diets that are available for those who have pre-diabetes. Which is the best diet to follow for the effective management of pre-diabetes? What would you recommend?
See, if one starts exploring the internet, one would come across lots of diets, with very fancy names. You have diet called the Atkins diet, the ketogenic diet, the paleo diet. Now, for most people, it's a very good idea just to follow a simple, healthy, well-balanced meal plan. Now, when you talk about a diet to a patient who has pre-diabetes, the first thing we tell them is that there should be some restriction from whatever calorie intake they are having at that point of time, because most of these patients tend to be little on the overweight side or obese side, and we want them to lose a little weight. So you start with calorie restriction from whatever levels they have. That's the first thing to be kept in mind. The second thing is that we need to watch the carbs. An average Indian consumes close to 70 to 80% carbs on a daily basis. That means 70 to 80% of energy comes from carb on a daily basis, and you need to reduce it to probably about 50 to 60%. So for most patients who have pre-diabetes or diabetes, the carb intake needs to come down. And as Dr. Varun rightly said, there should be complex carbs with a lot of fibers. So we are talking about legumes, we are talking about whole grains, we are talking about vegetables, fruits and nuts. And one should definitely avoid sugary beverages, fruit juices, fast food, junk food, which are all very processed and which are, I would say, which are high in GI. The last thing that has to be kept in mind is that there should be reduction even in the fat intake. A simple way of avoiding fat would be to cut down on most visible fats in the diet. So if you're having a lot of fried stuff, if you're having a lot of fast food, junk food, things like mixtures and bakery items and cookies, probably all those needs to be reduced. And even if you're having excess of non-veg on a regular basis, that needs to be cut down. So looking at the overall picture, a diet should be one which most pre-diabetics should be able to follow on a long term, because you're talking about a condition which is going to be there for a very long time, and following a diet which is very different from what you eat on a daily basis is little difficult over a period of time. Yes, short time you can follow, but not over a long period of time. So that's what's very, very important. Thank you.
Well, that's very useful advice as far as searching for the appropriate diet is concerned. A lot of questions still unanswered. We're going to continue this conversation on the other side of a short break. Stay with us. Back to you. There's a lot of talk about metabolic syndrome and insulin resistance. Can you explain what these phenomena are and how they're related to prediabetes?
Yeah, so metabolic diseases are becoming very prevalent, and they are the major non-communicable diseases worldwide. So just now, because we are in the COVID pandemic time, obesity is another pandemic which has been increasing all across the world, and we are seeing even pediatric obesity is very important. Besides that, prediabetes may even be a forerunner or co-runner with other diseases like polycystic ovary syndrome, also non-alcoholic fatty liver disease, besides the common variety of type 2 diabetes. So the basic metabolic reason for this is insulin resistance. So insulin, we know, is a hormone produced by the pancreas. It has got an origin which has got a production in the pancreas, but we know that after metabolism, it has to act somewhere. So the increased fat means the increased resistance is there for the insulin to act upon the organs in the periphery. So the muscles have to take the glucose. The liver has to probably metabolize all these energy. So we know that insulin resistance is a major reason where we have to address this problem lies. So the metabolic syndrome, the components for a simple audience would be that there are basically maybe 4 components. So 5 components are there. At least 3 or more should be there in them. So first is abdominal obesity. Abdominal obesity means the waist circumference is more. So they have a cutoff for a male and female. So there's also something called waist hip ratio in the WHO definition. Then the second one is the elevated plasma triglycerides. So not every in the lipid panel, so only the triglyceride is included in this panel of investigation. The triglyceride level is more than 150, then it can be an abnormal finding. HDL cholesterol, which is less than 40 in males and more less than 50 in females, is one of the reasons which can be used in a definition. Hypertension, because blood pressure elevated more than the required value. 140/90 is the one we usually mention. Any value which is not properly checked, we can miss the elevated blood pressure. Then we know elevated fasting plasma glucose, which is the one I already alluded to. And besides this, we also know that there are some other subtle markers for obesity like acanthosis nigricans, which is a marker by which we get a dark color over the neck, the axilla or the groins. So these are the markers which can be definitely screened when you are seeing a person from the distance itself. And we know obesity can even lead to increased neck circumference. So that can be fat deposit in the neck. So we all know that to define all these things will be difficult, which is why when we screen them properly by proper measurements by scores, we can arrive at the diagnosis of a metabolic syndrome. Insulin levels need not be measured in such individuals because they are only surrogate markers. Sometimes we have to do an HbA1c, C-peptide, just because we have to document the follow-up region. So this is the way metabolic syndrome is being diagnosed. Management is also a bit tricky because managing all that 4 components may not be required. When we give lifestyle measures, it can definitely control many of the measures.
Right. Dr. Kumar, does losing weight help to reverse prediabetes, and how much exercise per day is needed if you really want to lose weight to better manage prediabetes conditions?
Yes, of course, losing weight is going to help out in improving the pre-diabetes per se. So you consider pre-diabetes as a fork on the road. So if you find it, you try to overcome it. So when you try to look at the pre-diabetes, it is always the aim is to prevent the development of future type 2 diabetes mellitus. So if you try to ignore the risk of pre-diabetes mellitus, we always have the complication of development of type 2 diabetes mellitus, as well as the cardiovascular problems that can occur due to the, as mentioned, the lipid abnormalities, the cholesterol abnormalities, and the blood pressure abnormalities that will be noted in metabolic syndrome. So when you try to start doing exercise, particularly it is making the people to do better. The feel of the people also will be better once you start exercising, and the sleep is also going to be upregulated. So once the sleep and other the well-being is better, the hormonal imbalances that occur in pre-diabetes is going to be much better improved with the exercises. So it is always recommended for everyone to exercise when you have a pre-diabetes risk factors, and the exercises are recommended for at least 150 minutes per week. As a duration of at least 5 days. 30 minutes for 5 days duration. And you should not skip the exercises on even a single day. So you need to do exercises every day, at least 30 minutes a day. The aerobic exercises are recommended starting from a brisk walking. It can help out even walking at a pace which makes the patient to sweat out and have an increased heartbeat is also going to help out for a better well-being of the patient. So the pre-diabetes will be improved. The weight is also going to be reduced. The fat loss is going to be improved. So what happens in exercise is, once you start exercising, you are going to burn the fat. You are going to burn the calories that is being assimilated. So once you start assimilating a lot of calories, then it is going to improve the overall metabolic well-being of the people. So the ideal weight loss that is being recommended is at least you lose at least 4 to 7% of the weight the patient is
Right.
having. For example, if the patient is having 90 kgs, weighing 90 kgs, if
Sure.
you lose at least 4 to 7 kgs out of the 90, then the patient is going to be much better in improvement
Okay,
of the
that's
pre-diabetes
really
condition.
important. That's really important advice as well. Before we wrap up, just a last question to Dr. Behel. Should oral anti-diabetic medicine, I beg your pardon, be started when one is diagnosed with pre-diabetes, or should one wait till type 2 diabetes is confirmed before actually starting medication?
As of now, lifestyle modification, which basically means watching what you eat and doing regular exercise, that's the mainstay of treatment for pre-diabetes. We do use drugs, but those are in exceptional cases. And there are very few patients who need drugs. Close to 90 to 95% of patients with pre-diabetes just need diet and exercise to manage their pre-diabetes. We use a drug called metformin in occasional patients, but not as a routine. Studies have shown that lifestyle modification is as effective as medications to reduce the risk of progression to diabetes. So that is the reason why the mainstay continues to be just simple food control and regular exercise. Medicines to be used only in certain cases. Thank you.
All right. Well, thank you so much, doctors, for sparing your valuable time and answering all those crucial questions. Thanks very much for joining us.